Hi, my name is Hannah Besl, and I will be presenting today on IBM's Watson Health. So Watson is a computer program that specializes in cognitive computing. IBM, or International Business Machines, reports that Watson can understand all forms of data, interact naturally with people, and learn reason at scale. But one of the articles that I came across, I think, puts it a bit more simply, is that when IBM researchers talk about Watson, they're actually talking about a suite of computing capabilities that combine together to perform a function, taking large unstructured data sets in the English language and pulling answers to the queries out of that data. So in a sense, Watson is this giant database. People may ask questions and then receive meaningful answers based on the information that Watson has stored. Looking at Watson's rough timeline, I have depicted here some of the main events that apply to what I will be discussing. In 2006, IBM initiated the Watson technology and its use. That involved the development of the technology, which meant feeding the database an extreme amount of information. They took the information from encyclopedias and other online sources, as well as human interaction. So in 2011, it was ready to compete in Jeopardy! Some of you may remember that Watson competed in Jeopardy! Against two of the long-standing champions. The competition lasted for 3 days, and Watson ended up winning over $1 million in prizes. From there, IBM realized the potential that Watson had and began to pursue a future in the healthcare industry. So in 2012, Watson paired with WellPoint, which is an insurance company in the healthcare industry, as well as Memorial Sloan Kettering Cancer Centers. In 2015, so relatively recently, IBM took Watson a step even further by adopting predictive analytic capabilities. So talking about Watson and its capabilities, it's important to understand how everything works. Watson does have a database of information, but relies on algorithms, several hundreds of algorithms, to get to the answer from the question that is posed. The first step in the entire process is that the algorithms analyze the question. They pick it apart and recognize the important components and what needs to be addressed within the question. Next, Watson finds many potential answers and ranks those answers in terms of plausibility. Finally, Watson is able to assess the evidence in support of each of the answers and come to a result with confidence. You'll remember that in some of the Jeopardy! Questions that were asked, Watson chose not to answer the question. This is because his confidence wasn't as high while answering the questions after these algorithms were run and the evidence reviewed. So Watson's able to answer these questions as exhibited from the Jeopardy! Scenes. However, how does Watson learn? He learns from stored data, which comes from the development phase of the encyclopedias as well as different sources. Also, Watson learns from internet resources, maintaining current information from different articles, journals, and things of that sort. Additionally, Watson goes through human interaction to recognize and learn from mistakes that they may have found with some of the data that Watson has incurred. All of these components, though, that go into the actual learning process allow for Watson to provide real-time and up-to-date answers to all the questions that are posed. An important feature of Watson's learning process is that the system is able to comprehend and store free text, so the information does not have to come in numerical form. Now that you have a basic understanding of Watson, I will dive further into Watson Health. IBM's Watson Health currently has 5 programs that are available to the healthcare industry. The first is with genomics, which allows people to have their genotypes sequenced out and alerted if anything is might go wrong. The second is with drug discovery. There are a plethora of different pharmaceuticals in the market currently. Drug discovery allows Watson to go through someone's file and find a drug that meets their needs for their ailment while keeping in mind allergies and other restrictions. The third program is patient engagement, which is a tool that clinical professionals may use to engage patients and keep them on track with their health goals. This is important as we move towards a value-based healthcare system. The fourth program is oncology. This helps physicians in both the diagnosing and treatment phases of cancer. The fifth program offered currently is the Care Manager, which is a platform that allows those clinical professionals to engage with the patients even more. I will talk more about the genomics and the Care Manager programs. The first program that I'll be discussing is IBM Watson's Health Genomics program. This program serves to identify specific cancers and how best to treat them. They've paired with Quest Diagnostics in order to carry out this entire program. The first step is for an oncologist to send a tumor sample of an individual to Quest Diagnostics. The second step is that Watson will run the tests and compare it against other genotypes in order to assess any mutations that may be at risk. From there, the third step is to research best practices and treatments that may be available for that specific type of cancer. The final step is to send the results to the patient's oncologist for final assessment and treatment options. This Watson program is incredibly important. As I mentioned on the previous slide, it does increase accessibility for patients who are unable to travel to cancer centers that are well-renowned throughout the country. 70% of people with cancer in the country are not receiving care within a cancer center. Therefore, Watson can help that 70% of cancer patients so they do receive the best care. Secondly, the Watson Genomics program provides individualized cancer treatment. 75% of cancer patients will not respond to a particular cancer drug, and unfortunately, a lot of prescribed medications are a guessing game. By utilizing Watson, they have an increased chance of a cancer-fighting drug to actually work on an individual. And lastly, this program serves to educate physicians who are unable to also practice within these cancer centers. They learn the latest innovation as well as best care practices. The second IBM Watson Health program that I will discuss is the Care Manager. A large trend in the United States right now in the healthcare industry is a shift towards value-based care. More simply, this means that physicians will be responsible for having a more holistic view on patient care. This includes any other diseases that they may have or any other social determinants that are in their life. Luckily, Watson has risen to the challenge and now offers the Care Manager. This is a platform that enables clinical providers access and able to integrate a patient's needs. This includes needs across locations, across physicians, and even with different pharmaceuticals. Depicted here are all the areas in which Watson's Health Care Manager is able to help. In order to make the Watson Health Care Manager program the best that it could be, IBM looked to partner with all four of these companies. This allows the program to have the largest capability possible and provide the best results to their physicians. Things that are addressed in this particular platform are things such as reduction on 30-day admissions, which are increasingly important. This is because with the shift towards value-based care, the healthcare healthcare industry must be aware of these different measures in order to receive full reimbursement for services rendered. Due to the success of these programs, there are several large organizations within the healthcare industry that have partnered with Watson Health and are currently utilizing them in their facilities, one being the Cleveland Clinic. In fact, the Cleveland Clinic has had a long-standing relationship with IBM and began in 2011, almost directly after the Jeopardy games occurred. The physicians at Cleveland Clinic trained Watson to think like a doctor, so he would be appropriate to use in the clinical setting. Additionally, they piloted the Watson for Genomics program in their centers. They've also utilized Watson as a tool for their medical students to learn and are currently working with IBM Watson to establish a population health initiative in their area. Another healthcare organization that is utilizing Watson Healthcare is the Mayo Clinic, another industry giant. They are utilizing the system within their trials for cancer drugs. Currently, due to all of the screening that needs to go in before each patient is accepted into a trial, it takes an extremely long time. This is creating a bottleneck, which helps neither the organization nor the patients looking to receive care. Currently, only 5% of the cancer patients within Mayo Clinic are enrolled in cancer treatment trials. Their goal with the utilization of Watson Health is to double this number. It's important to remember that with both the partnership with Mayo Clinic, Cleveland Clinic, and any other healthcare organization, they gain information from Watson. However, Watson's also learning from them and becoming smarter and more evolved in the areas of healthcare. Most innovation comes with hesitations and concerns, and Watson Health is no different. Two examples of the concerns for Watson Health are with physicians and the interactions with MD Anderson, a cancer center that is well known in the United States. The first concern comes with physicians. They feel as though they're being replaced. Although IBM has taken considerable effort to emphasize that Watson's merely to be used to augment a physician's knowledge, not necessarily to replace them. However, some fear that radiologists may become obsolete, as Watson's currently working to interpret images such as MRIs and CTs. The MD Anderson example occurred within MD Anderson at their cancer center. After a few years and a $62 million investment, MD Anderson decided to cancel their contract with IBM and the use of Watson due to unmet expectations. Although there are some extenuating circumstances surrounding the entire business of the contract, this still causes some problem for the IBM company. However, there has been a lot of benefit, and IBM has sought to focus on the successes rather than the downfalls within MD Anderson. In addition to concerns throughout the industry, IBM also has to be aware of different competitors that are entering the space now. Both Microsoft and Google are developing artificial intelligence programs that can be used in the healthcare sector. While there isn't currently an offering available, their development is well known, and it's anticipated that they will enter the market. Additionally, Johnson & Johnson has elected to develop their own artificial intelligence within their company, focusing specifically on their pharmaceuticals. Within their pharmaceuticals, they've utilized this technology in research and development. IBM needs to be aware of both the competitors and the concerns that are being raised in the industry in order to maintain their advantage in the marketplace. As we've learned from other modules, it's important that businesses react in order to stay current. I would like to thank you for listening to my presentation, and I look forward to answering any of your questions. Here are my sources if you all are interested in following up on more information.